from an 88-year-old man, went from nursing home to Danbury Hospital, and he died of complications related to COVID-19. And the first death is not unexpected, but it's a shock. It's a shock because it makes this so real for all of our families. Our hearts go out to that man and his family. Moment of silence. Our hearts go out to all the families across the state of Connecticut and our great state and our great country. I've just trying to talk to our ministers, and we couldn't get on the phone because the lines were overwhelmed. We were talking to our United Way 211 folks, and more calls today than ever before, over 2,500. Some people looking for facts, some people looking for solace, just want to know what is going on. We've been busy. I talked today with all the governors, and we pushed hard on what we need from the federal government and what each and every one of us is doing here at the local level, working with our mayors and superintendents. There was, a sense that tomorrow is too late. The federal government, it's time to wake up. I'm pleased to announce they passed just, I think, in the last, half an hour or so, a $200 billion supplemental. And that's going to be helpful in terms of Medicaid support so we can expand health care to more people so nobody doesn't go treated, so that they can get testing without any cost. It includes unemployment compensation. It includes paid sick leave. And again, so if you're not feeling right, if you feel like you may have a case of just the flu or little early symptoms, stay home. And if you're paycheck to paycheck, we're taking care of you. And the paid sick days will take care of that. That's just the start. The feds are working on other programs right now. They're talking about a $1 trillion program. I've been talking to our congressional delegation. I hope they get it. I mean, I'm talking to small business folks every day, and they're telling me they're having a hard time keeping their doors open. So don't tell me about a tax credit or a payroll tax deduction. I'm having a hard time meeting my fixed costs. I'm meeting with the health insurance folks, seeing if maybe we can delay any obligations to make payments there. We've worked with our electric utilities to help small business and individuals, so maybe we can defer some payments there. As you know, we've deferred all forbearance in terms of loan payments on any of our state loans, doing everything we can to help individuals and small businesses power through what is a complicated time, and doing what we can to make sure they'll be there on the other side. I think you heard yesterday from David Lamont, if you can keep people employed, we'll find a way with unemployment compensation to pay for some of the cost of that person. Hopefully they can telecommute from home. They don't have to come into the office, but give people a sense of certainty that we're getting through this. It's wonderful that the federal government declared a national defense procurement emergency. That means at long last the federal government is going to push our major manufacturers, large and small, to do a better job when it comes to making the ventilators, making the protective equipment, making the masks that we need so desperately. I've been talking to urban health clinics. Some of them say they've got just a few days more of swabs. Some good news. I'll tell you, we got our first shipment of some of the PPE and swabs. We're getting some support from the federal government, but as I said, tomorrow is too late. I can tell you we're working very closely with our hospitals, doing everything we can in terms of a supply. Anything that's not absolutely urgent, anything that's not life-threatening, anything that's at all discretionary, if you can put that off, and that means at that ambulatory clinic, at that other health clinic, outpatient, dentist, some of you have the protective gear that we need. Not filling that bed with somebody coming out of surgery that may not have been absolutely urgent is going to free up a bed for somebody who may be afflicted with COVID-19. And we need each and every one of those beds, and we need each and every one of the nurses and specialists to come along with that. Look, we can do this. I mean, National Defense Procurement Act, 80 years ago, FDR said, America, it's time to ramp up. We're at a war. And look at the number of Sherman tanks and bombers we were able to build on very short notice. I think we can get it together. I think we can get our protective equipment and gowns together. We can do we can get our masks. We can do our ventilators now. Now is the time we've got to do that. Working closely with our health partners every day, seeing what we can get from them. We are going to get through this. I was never so proud as today. We are to have our now a virtual emergency operations center, and talking to each and every one of our commissioners, giving us an update, working together, hand in glove. I mean, people sometimes wonder what state government does. They know what state government does now. I am particularly touched by Beth Bye and what she's doing in terms of early childhood. You maybe heard me say, please stop closing down our daycare centers. We need some of these open. We're having a hard time, in some cases, whether it's nurses or healthcare professionals or first responders, and even some of our departments. When the kids are home from school, we got to do a better job being able to take care of them. And I hope to God most of you have a family member or a loved one or neighbor that can take care of those children, and maybe they don't have to go to daycare. But we do need daycare available so that those nurses and doctors and other first responders can get to work and be confident. And Beth Bye's working on that. She's trying to put together a daycare right now and childcare adjacent to or at some of our hospitals, nearby our nursing homes as well. Doing everything we can to make sure that our first responders are able to keep working. Look, we also had at the meeting Housing Commissioner, DSS, mental health, all the other things that get unleashed when you're confronted with a crisis like this. I mean, look at the number of folks who are homeless. And if you're homeless and you get infected with COVID-19, where do we put you? Where can we find you so you have a safe place you can be? We're trying to find additional facilities, field hospitals, other places, so that for those in need of just intermediate care, no longer in a crisis or critical condition, they can free up beds in our hospitals and make space for others going forward. Look, we've been in contact with all of our regional governors. Josh can tell you about some of the other things we're doing together. We just issued a declaration as regards our major malls. We're going to be closing them down here in Connecticut like they are in Rhode Island, New York, and New Jersey. Again, one more place where people are likely to congregate, one more place where people might get infected. And we're doing this out of love for each and every one of the citizens of this great state. We just put up the electronic billboards up and down our highways. It says, if you're sick, stay home. If you're over 60, stay close to home. Heal thyself. These are the messages we're trying to share. Look, I'm going to introduce you to Renee Coleman Mitchell, our amazing Commissioner of Public Health. I just want you to know that we've been planning for this. Nobody can plan for this wave that's breaking over our country right now. It's coming faster than we could have ever expected. We've had 28 new people that were found to be infected with COVID. That's 96 in total now. That's the biggest number we've had before. And the numbers are going to grow. And we're going to get this together. We're going to get it by working together. We're going to get it by working together as a family, the Connecticut family. Your state government's rolling up your sleeves. The hospitals are rolling up the sleeves. The parents are doing what we can. Renee, over to you.
Thank you, Governor. Good afternoon. My name is Renee Coleman Mitchell. I'm the Commissioner for the Department of Public Health. I'd first like to take the moment to extend condolences to the family who lost their loved one. With that said, we also have to report another positive COVID-19 case at a nursing home. An elderly man who is a resident of Evergreen Health Center in Stafford Springs has tested positive for COVID-19. He's currently hospitalized at Johnson Memorial Hospital in Stafford Springs. After consulting with Centers for Disease Control and Prevention and the Centers for Medicare and Medicaid, to talk about our next steps in disease monitoring, a team from DPH has been deployed to address this issue this afternoon at the nursing home and at the hospital to review mitigation efforts and infection control procedures to slow down and prevent the spread of COVID-19 within our nursing homes. I also like to report that we are still working diligently in having a number of alternate space sites on hospital campuses throughout the state. We currently have 11 alternative hospital sites up and running to do testing, to do sampling, and to forward those specimens out for testing. I also would like to encourage individuals to continue to utilize 211 if you're asymptomatic and you have general questions. If you're symptomatic, you are to call your primary care provider, but we are asking folks to, again, use the 211 hotline. Thank you.
Thank you. Miguel Cardona, Commissioner of Education. First and foremost, I want to extend condolences to the family of the deceased. I also want to share that the school year is not canceled. Some have asked questions about whether or not the school year is called off. It's not. We hope to welcome students back, but at this point we're taking precaution, and if we have to extend class cancellation, we will. My purpose in being here today is to share that although we find value in assessments, the governor has asked me to seek a waiver for standardized assessments from the federal government. So we will, as an agency, be seeking waivers. We don't feel that if students are out for an extended period of time, bringing them back to school and sitting them down to take assessments is the best way to use their time. So we are going to be seeking waivers from the federal government on standardized assessments. The SAT will provide more information. We know that many seniors use this information for college preparation or to get accepted into colleges. So we'll share more information on that. At this point, I want to thank all the educators that have stepped up. And as the governor said, we're seeing the best of our educators and we're seeing the best of our community here to rally for our students and for our community. Thank you.
Take your questions.
We have to name the facility, excuse me, in Ridgefield,
Yes.
and what's being done for the residents in that facility.
Yes, the facilities, it's Benchmark Senior Living at Ridgefield Crossing. Of course, we're taking all the precautions, and that's why we deployed a team to go out and look at the infection control procedures, both at the nursing home and also at the hospital.
How many residents are there?
I don't have that information at this time.
Do you expect they get tested?
There will be procedures and assessment that will be done to decide whether we need to test all of the residents or not.
Has anyone else at that facility tested positive?
To date, there are 2 individuals that we are closely watching, and that's all we have at this time. Again, we've just deployed staff to really go in and assess the situation.
Is that for Richfield or staff?
The facility, the assisted living facility, is called Benchmark Senior Living at Ridgefield Crossing.
Okay, so there are 2 potential other positives there.
I'm sorry. Let me clarify. And let me take a step back. And I apologize for the discrepancy. It is Evergreen Health Facility where we have our COVID-19 positive. What you were referencing is the individual that has passed away where they were from.
Nobody else in Richfield tested. Did you also dispatch a DPHT to the Richfield facility to see if there's any other information, whether contact, investigation, or anything else your team can do?
DPH, as a regulatory agency, our role and responsibility is to always go out and assess the situation in regards to infection control procedures whenever we have these situations occur, when there's infections or outbreaks.
So yes, you have a team in Richfield as well?
We will be deploying a team at Ridgefield, yes.
Just so I get it straight, in Ridgefield, where the gentleman passed away,
Yes.
has anyone else at that facility tested positive?
Not to our knowledge at this time.
Regarding the swabs and the PPE, where are we? Are hospitals running short of those? Has it slowed down the state's ability to do testing?
Not yet. So we haven't had any reports yet of anyone who's run out, which is essentially your question. But we do know, as the governor mentioned, that some facilities are getting increasingly concerned that they're starting to run low on some of those supplies, which is why the governor, issued the call that he did a moment ago to all healthcare facilities around the state, including dentist's office, really anyone who has personal protective equipment that could be useful to those on the front lines of caring for COVID-19 patients in the coming weeks, that we're asking them to not consume those supplies with elective procedures or procedures that are not life-saving in the next several weeks, and instead donate them through our process with the public health department so that we can redeploy those to the front lines of the fight against COVID-19.
And do you have the number of people who have been tested? The 96 positive?
Yeah, so the team has been working to collect all of the negative test results from all these private sector labs all over the place. We now have compiled data to indicate that we have over 700 tests completed statewide, of which 96 are positive.
How many hospitalizations, do you have an update on that?
24 hospitalizations as of 4 o'clock.
And is it across the whole state now, county by county breakdown?
Well, yeah, I think we added our first case in Middlesex County. The details will be in the press release that's coming out.
Is the 700 from the state lab, or that's now state plus private?
That's all. So that's state lab plus private testing and a wide variety of sources that are doing private testing.
Is there any sense of when this will be?
We don't have the exact figures from that. I think you probably have heard this from Dr. Matt Carter in regards to this is very new for all of us. What we know is that we are expecting a surge, that there will be increases, and if you look at the numbers that we've been sharing with you day by day, it's increasing by leaps and bounds. So we don't have that exact date or time when the surge will occur, but we are planning and preparing for it to happen.
To follow up on that, there was a report yesterday from the Imperial College that kind of said that the only way to avoid this is to continue social distancing until there's a vaccine, which would mean a year. Are you anticipating anything of that nature, social distancing for a year from now until there is a vaccine, or 18 months, whatever that might be?
We continue to message as much as we can that social distancing is absolutely expected, and we continue to share that folks should continue to do social distancing. We don't have, again, this is very new, we don't know for how long we're going to be on this road, but at the same time we are encouraging people to continue to social distance, absolutely.
I know you guys are uncharted waters, but is there anything in the playbook as far as what a potential next step might be? You've done social meeting, you've tightened up all kinds of social contacts, malls, whatnot. Is there anything else that's under consideration that would further enforce that message and that reality?
So first of all, uncharted waters, yes, but we can see by example what's going on in other locations. You see what happened in Singapore, you see what happened in Hong Kong, you see where they took social distancing seriously. They're able to mitigate the duration, they're able to mitigate the intensity of what happened. You look at Italy and perhaps other parts of Europe where it's a lot more severe. So that's part of the answer in terms of what can you expect going forward. I cannot emphasize enough what a difference social distancing makes. I can't tell you what happens at the end of this. If it slows down in the summer, does it come back in the fall? If it comes back in the fall, we've still got to be relatively careful, I would think. If it comes back in the fall, will we have a vaccine? Well, look, we're not taking this one day at a time. I think we know what we should be expecting and planning for, looking at what happened over other countries over the next 30, 45 days. And there I want to make sure we've done everything in terms of social distancing and lifestyle we can to mitigate the pain and effect in our state.
Well, if I could follow up on that, in Italy, they basically shut down the entire country. So
it took them a long time, Pez, to shut down the country there. And it took them a long time to close the schools, and their cafes stayed open. A lot of young people didn't take it, let's say, as seriously as they could. And if I could say anything to the young people, the invincibles out there who must be a little frustrated, this is really important. It's for your safety, it's for your parents' safety, and it's for your grandparents' safety.
Have you made a decision yet on the primary?
We've not made a decision. I've been talking to our fellow governors on that. My hunch is it'll be delayed.
Are we looking at a total lockdown potentially, a stay-at-home across the board?
As I said before, if people do the right thing, you don't need government to enforce it. If young people understand what it means to stay away from those social interactions and stay home, if older folks make sure they stay at home and don't go out, all the things that maybe a lockdown would try and accomplish, I hope we can do that voluntarily. This is America.
On that point, Governor Cuomo had basically said, as you saw today, basically 50% of the workforce in various businesses should be working from home, except places like pharmacies and things of that nature. Have you considered that type of...
I've strongly recommended that to our businesses, our municipalities. Obviously, Chris, every department and every business is sort of different. We're finding that in state government. Some places we need 80% of the people there. Other places maybe less than 30%. But obviously, the real incentive is to keep as many people home as you can. And if you're a business person, you don't want everybody there at the same time in case there's an infection. It's prudent to separate out your people so they come at different times.
In terms of the hospitalization, are you able to put the 24 in some perspective? Do we know what our total capacity is, and have the hospitals given you kind of any indication of how quickly
They have. You want to take that?
Yeah, so I mean, we track on a daily basis in the Emergency Operations Center. We have a dashboard that shows, available beds across our hospital system, hospital by hospital. I think as of this morning, we had over 1,200 beds. Obviously, not all of those are in, currently configured to care for a COVID patient, but there's capacity in the system. But our hospitals, as the governor mentioned, are working very hard right now to reconfigure spaces in anticipation of a surge of acutely ill patients that do need the types of precautions to care for a COVID-19 positive patient. So there's a tremendous amount of activity going on in that area right now.
Based on the numbers that Dr. Carter gave us yesterday, he was mentioning basically 6,000 people he thought had the disease, and 20% will require hospitalization. Do you expect to see, I assume the answer is yes, but why haven't we seen more hospitalizations based on those numbers that I just mentioned?
I'll take it. I think, for one, in terms of testing, what Dr. Carter was saying is we're only testing a small sample, and we know from that sample the number of people with those infections. But more importantly, he estimated it could be 100 times that more people who are infected and don't know it. Most importantly, not everybody has to be hospitalized. I want to remind you, in the overwhelming majority of people, COVID-19, like the flu, is something you stay home, self-quarantine, watch yourself, drink plenty of fluids, and wait those 14 days. So not everybody needs hospitalization. What Josh is talking about is we got to make sure those folks who really are afflicted and have the most critical conditions, we have the beds for them. And if we don't have the critical care beds, at least we have some intermediate beds nearby so that they'll be taken care of as well. Thank you very much, everybody.
Can I ask you a follow-up just on the...
How you doing, Katie?
How you doing? How's things? Okay, I guess so. I hear you.